We are live now.
So, yes, greetings everyone. Wonderful, wonderful. Oh, I forgot to make the request to have the advertisement for today up. I wonder if that's still a possibility to show that off a little bit. Welcome everyone. Thank you so much. Greetings. Welcome to Southside Community Center's Black Town Hall. We have a series of gatherings, engaging folks in powerful conversation, transformative work. We are truly, truly grateful to host tonight's event. My name is Dr. Michelle-Nunn, and I'm a professor at Ithaca College in the Department of Education, but I have the glorious privilege of serving as the board chair of Southside Community Center. We have fellow board members on the screen, as well as a long list of incredible leaders and community members here in Ithaca, New York. So here we are honoring that specificity unapologetically. And so I would like to go around and introduce folks. And I don't want my introduction to be limiting. While this is a short period of time, I do want to make sure that each person feels welcomed and acknowledged. And so I want to first, before we pass the mic to folks who will be presenting the information that is central this evening, I'd like to introduce our guests. So I'll start with Mr. Amos Malone, board member of Southside Community Center. But sir, like many of us, you wear multiple head wraps. So if you wouldn't mind unplugging and letting folks know who you are, that would be beautiful.
Hi, I'm Amos Malone. Just want to say thank you to everyone for taking out time of your busy schedules to be with us today to address some of these most important issues that we're dealing with in our city and county. I'm just interested in listening, hearing what you all have to say and how we can make this city and county our own and to make it absolutely better and to be the envy of the rest of the nation.
There you go.
There you go.
Awesome. Thank you so much. And now to pass the mic to we have three staff members from Southside, but I'm gonna pass the mic down there to Miss Kayla and Nisaya, our youth program leaders at Southside. You all say hello. I know that you have some babies that you just sent off with their parents, but so thank you for joining.
Yes. Hi, everyone. I'm really looking forward to this discussion today. Just one, hearing about the research that was done in to come up with the proposal, and then just also hearing other community members' opinions and other questions that they may have regarding it.
Excellent. Thank you, Kayla. Thank you, Nisaya, for being with us. Wonderful. And I'm going to pass the mic to Mr. Charles Rohde, which we calculated next week is 25 years of service at Southside Community Center, our food and nutrition coordinator. Mr. Rohde, you want to say anything to the crowd?
I'd like to say grace and much peace to you all. I'm just here to hear some good information and hopefully we'll make some changes in Ithaca, New York. That'd be a blessing for everyone.
Excellent. Excellent. Okay, beautiful. And now let's see, I will pass the mic to our elder, the esteemed Mama Phoebe Brown. If you wear multiple head wraps in this community as well, would you mind introducing yourself to everyone, Mama?
Hello, everybody. I'm Phoebe Brown. I work for the Alliance of Families for Justice. Let me take this out. And we work with people returning from prison, people who are incarcerated, specifically people who have loved ones incarcerated, and anyone who's ever had a criminal record. And we do a gamut of things. So if anybody knows anybody who's interested and need help, please give them my number to call me or my email. I'm a part of the mutual aid. I do a whole lot of stuff. My grandkids says it's because I'm nosy, and that's true. And I've also have a passion that I need to leave the next 7 generations better off than me. So yeah. So wherever I can create ruckus, that's where I am.
Excellent. And I just love it. And every time we reach out for your glorious presence, Minion, you're here and we're so grateful. So thank you always, Mama Phoebe. I'm gonna pass the mic to Mr. Harry O. Smith. Next, the Executive Director of Black Hands Universal. Let's see if Harry is there on the screen. Yep.
Hello, everybody. Harry Smith, ED of Black Hands Universal. I guess there's really I don't really have an exactness of what I do. I just do whatever I think needs to be helped, and I just help whoever I can. That's it.
Awesome. Thank you. Thanks for being here, Harry. And I'm going to pass the mic to Miss Nicole LaFave. Again, incredible leader of our community, multiple head wraps. I was going to start the list, but Miss Nicole, if you don't mind introducing yourself to the crowd, that would be amazing.
Thank you, Dr. Nia, for inviting me. My name is Nicole LaFave. I am originally from New York City, Harlem. I graduated from Ithaca College. I'm 36, so I've been here officially 18 years, and unfortunately I have to call myself an Ithacan. I have 3 children. I'm on the Board of Education of the Ithaca City School District, co-founder of, one of the co-founders of Black Lives Matter Ithaca. I've spent time on the Ithaca City Community Police Review Board. Here today to have an honest, authentic conversation around how to make sure everyone in our community can live in equitable. We're talking about community policing, really unpacking what that means. What does it mean to feel safe, emotionally and physically safe? And who gets to define that? So I'm here to join the conversation and just bring some open perspective, and always happy to see Phoebe on the screen.
I'm so happy to see you too.
Beautiful. Again, thank you. Thank you. I know that so many of you, all of us, were so busy. So thank you for allocating time to be together. I'm going to pass the mic to Miss Mona, because I know, again, we're all full, multiple head wraps. And so I know that you may not be able to stay with us the entire time, but I want to give you an opportunity to introduce yourself as well. Miss Mona.
Hi, thank you. I'm Mona Smiley. I'm the Director of Youth Outreach of the Learning Web. So I'm a native. I was born and raised here, left for school, came back. I have 3 Black males that I'm raising or have raised. So I'm here today to just get some more information and hear what everyone else has to say about what's going on around their community.
Thank you so much, Mona. Thank you again for being here. Passing the mic to Miss Denise Malone. Please, welcome. Thank you for being here, Denise.
Thank you. I'm Denise Malone. I'm the mother of Kaji Ferguson. I decided to be part of this conversation, having a young male, Black male that has been wronged by the Ithaca Police Department. I just want to be able to hear what it is that's going to be going forward, and seeing if there can be some type of interventions for these type of things not to happen again amongst our Black, or anybody for that matter, within the Ithaca community.
Thank you, Denise. Thank you for being here so much. I am going to, there's 3 more folks. All right, I'm going to pass the mic to Rakim Jones. My brother, thank you for being here.
Hello,
Introduce
everyone.
yourself, please.
Hello, how you doing, everyone? My name is Rakim Jones. I'm a born and raised Ithacan. Yes, so what brought me here today is I got invited by Dr. Nunn, Dr. Nia, and I'm here just like everybody else. I just want to see what's going on with this, the future of public safety. So I just want to get more informed on the direction we're going with that. And yeah, I'm here. I'm getting where I fit in.
Excellent. Excellent. I'm going to pass the mic and welcome Yasmin into the space. Thank you so much for being here today.
Hello. I'm Yasmin Rashid, local activist, executive board member, UPI, and current Common Council candidate for the 1st Ward. I am responsible for 2 young Black men and a young Black woman. So it's just always necessary that I bring balance where I can. And, you know, I always show up authentically and be who I am so that they can understand that the world will adjust.
Thank you.
Thank you.
Thank you so much for being here, Yasmin. And passing the mic, I believe, finally to Dr. Russell Rickford. Welcome, sir. Thanks for being here.
Hey, everybody. Thanks so much. It's good to be here with you. It's an honor. My name is Russell Rickford. I'm a historian at Cornell, specializing in the Black radical tradition. I'm also an organizer with the Ithaca Democratic Socialists of America, as well as the Tompkins County Anti-Racist Coalition and the Tompkins County Workers Center. And I think my role today is just to emphasize that, you know, truly effective and genuine reform must be built from the bottom up, cannot be imposed from the top down, and it has to reflect the genuine aspirations of working people for better lives, right? It has to reflect the kind of change in people's material realities they want to see. So that's the emphasis that I'll be making today on grassroots struggle and how we build the kind of bottom-up movements that can bring us closer to that vision.
All right. Thank you, Dr. Rickford. Thank you so much. And so each person that introduced themselves, those of us who have shared so far, we serve as panelists, as community representation. And while we have a variety of folks missing, people are tuning in, and I'm looking forward to the discussion. We are, let's see, a great majority of us were born and raised in Ithaca, and we are parents of Black children, among a long list of other things as educators and leaders in our various roles in this community. So here's who we are. I want to thank Deanna, thank my mother, Schelley Nunn, and then I would love to pass the mic to our Mayor Svante Myrick and 2 fantastic researchers and scholars that I get to call colleagues, and that's Dr. Sean Eversley Bradwell and Dr. Belisa Gonzalez, who will be presenting to us this evening alongside Mr. Jason Molino as well. So thank you all for coming and doing the work that you will do with us this evening. But then finally, I would like to pass the mic to this fantastic sister that I just met, who will really be guiding us in the discussion afterwards. And that is Miss Dominique Johnson. Welcome to Ithaca virtually.
It's really great to be here. Okay, you have it. You have the moderation going. I'm like, I just want to be here in your presence. But in all seriousness, thank you guys so much for holding space. My name is Dominique Johnson, and I'm the Senior Director of Community Engagement at the Center for Policing Equity. So I was just asked to be a part and share the space tonight, be able to facilitate questions that may come through so that folks can have the space to lift those up. But this is your space. I'm an outsider, and I want to just be supportive in wherever way you need me to be supportive. So if you feel more comfortable with Dr. Nia holding down and bringing her light to it, we'll tag team and make it happen. But again, thank you all so much for just having me be a part of your space. And y'all are leading the nation, okay? Just to let you know, I do this work with different communities throughout the country, and everybody is pointing to this right now. So just kudos to yourselves. Like, everybody is looking and wanting to see what's happening here. So if I can be of support in any way, I'm here. So thank you so much.
Thank you. Excellent. All right. So I think it is at this time that I will pass the mic to Svante. Svante, you ready for?
Yes, thank you. Thank you. And I appreciate it. And Jason, do you want to run the PowerPoint, or is Dominic run the PowerPoint?
Jason's got it. You do?
Got it. Well, I want to thank you. And Mr. Jones said, it sort of made me laugh. Hold on, let me turn off my background. We said, I'm here because Nia asked me to be here. And that's been my philosophy too, which is do what Dr. Nunn says, and things are better. In fact, including when Dr. Nunn changed my calendar back to May so that it would always be Dr. Nunn's month. And that was May 2020, and it is still and forever going to be Dr. Nunn month here in the mayor's office. We really appreciate it. And Dr. Nunn, to make this kind of space at the Southside Community Center virtually is really kind and generous and important, because this work, the mandate that came from the governor and our intention when we set out was to center the experience of African-American communities. And that's exactly what the Southside Community Center has done for coming up on 100 years here in the city of Ithaca. We're just going to walk through these recommendations. Jason and I will take turns walking through the slides. What you'll see are the 19 recommendations. But first, I want to speak a bit about what got us to those recommendations. So, 9 months ago, uprisings across the country focused attention back again and again and again on the killings of Black people at the hands of law enforcement. And it was George Floyd's death, along with too many others to name, that got Governor Cuomo to issue Executive Order number 203. Now, Executive Order number 203 required all municipalities that have police departments to undertake a reform and reimagining process, take a look at all of our policies, take a look at our structures, and take a look at the very way we deliver public safety and come up with something better. But here's what was important, and here's what has been the challenge, and what we're still here today trying to figure out the best way to do, is that they didn't want, as Professor Rickford said, this can't come from the top down. And even the executive order, and here's the paradox in it, there's an executive order literally coming from the governor saying, find out what the community needs, right? It didn't say, ask the police department how it wants to be reformed. It didn't say, ask the common council. It didn't say, ask the mayor what he thinks needs to happen. It said, go to the community and do a true public input process. That was extremely difficult. It's extremely difficult in normal times when the normal channels of power and influence are already so stacked towards the people who already have power and influence, right? To say, come to a city council meeting at 6 p.m. Wednesday. Trust that everybody is free at 6 p.m. Wednesday, not taking care of their children, not working their second job, not going to school, but also that everybody feels comfortable walking in the city hall at any time anyway. So we needed to find different avenues and channels to do that public input. And that's where I have to give so much credit to our community partners, Dominique in the Center for Policing Equity, Schelley Michell-Nunn, Deanna, Dominique, partnering with Dr. Gonzalez and Dr. Bradwell to do a deep and thorough community input. Well, why are we here? It's because as deep as it was and as thorough as it was, it's not complete enough, right? We do not have enough input. We do not have enough feedback. And we're here today to get more. We want to present to you these recommendations, these 19 recommendations, which are in draft form. They're going to be considered this month by the county legislature and the common council to say, yes, go forward, or no, change direction. And if they pass, they will no longer be draft, but they will still be for every purpose a living document. That is to say, a document that will continue to be adjusted and changes will be made to it. So are we set for the first slide?
You ready? Sure, we can start. Can everybody see that?
Mm-hmm.
Presentation. Also, just want to thank everyone. Thank Dr. Nunn for inviting me and inviting us to this and the Southside community to talk through this. The only thing I would add to Mayor Myrick, and I think 2.0 are great points, that this had a lot of involvement, and important factor of making it move forward is that it continues to have a lot of involvement from community members. As it continues to change over time, that community engagement, that feedback is going to be critical to see how we're making, how's the community moving, how's the county moving, how's the city moving forward, is it having impact, and if it's not, how do we change course and correction? One thing I do want to stress too is the executive order. The executive order told municipalities to develop strategies to address discrimination and racism in policing. It came after the death of George Floyd, and it specifically speaks to continued mistreatment of Black and Brown community members, and directs all the communities to put strategies together to eliminate racial inequities in policing. I want to stress that point because it's the purpose of the process is to focus on marginalized members of our community and develop better practices and better address the needs of our communities of color. And these recommendations were looked through a lens of equity. We received recommendations that did not necessarily impact inequities in policing, and we didn't consider them as part of this. I will also say that all the people that worked on this, not everyone agrees with the recommendations, and this process over the next few weeks and months is really about understanding them more, getting feedback from community members, and then improving them where they need to be improved, removing them if they need to be removed, and adding new ones if they need to be added. So this is 19 recommendations. Most of them are joint and collaborative. There are ones that are specific to the city, and there are some that are specific to the county. So Mayor, why don't you start with the first one, and then I'll move on to the second and third.
Perfect. So the first one is one that's obviously grabbed a lot of attention, which is the creation of a new department to replace the police department. This will be a department of community solutions and public safety. And before you say it, everybody else has already said it. The name is not great. Could use some work. If you have suggestions, welcome. What's the purpose of creating a new department? Well, what became clear is that we need a broader understanding of what public safety delivery is for a municipality. That just having a police department was not enough to respond to all the varied and very different demands for service that our police department sees every day. And when that has happened in the past, in the decades and generations past, when the need for public safety is expanded or changed, the response has been just to add police officers. That has proven to be difficult for several reasons. But one thing that jumped out of the data is how the militarization of police and the presence of weapons and interactions where weapons are not needed and are not likely to ever be needed unnecessarily exacerbates tensions, raises risk level, and increases danger for the officers and the community alike. So the idea in a new department is that you would still have armed public safety workers that respond to things that we typically think of as police responsibilities now. But you would also have community solutions workers, people who could respond to the type of calls for service that don't result in arrests and that have low incidences of danger or conflict. Those folks could show up, have a broader presence in the community, do the kind of foot patrols and community interactions that many people are asking for, without introducing the weaponry and militarization that has a lot of people nervous based on both their past personal trauma and the experiences that they're witnessing nationally and have witnessed for, pick a time frame, hundreds of years.
Thank you, Mayor. The next few I'll talk about. These are primarily county initiatives. Evaluate existing models and implement an alternative to law enforcement response system for crisis intervention and wraparound health and human services. So this is something that was talked about a lot from a lot of different focus groups and a lot of different feedback, and that there are better ways to respond to calls, particularly those in crisis, particularly those that may be experiencing mental health challenges or mental health crises other than a uniformed officer. And there are definitely situations where perhaps a social worker or a mental health professional should be the primary responder with a co-response of law enforcement or a secondary response. We met with several different groups across the country, one of them being a cahoots model out of Eugene, Oregon, which is contracts with a nonprofit that's a dispatch to scenes many times to either co-respond or respond instead of uniformed law enforcement officers. It's a model that they've used for over 30 years and have had a lot of success with. This seemed to be a very common suggestion and thought from many members that provided feedback that we want to see something other than a uniform law officer response, particularly in areas of health and human services. So this is a recommendation that over a 12-month period of time, we research and implement what is this alternative response model countywide. This is not intended to be an entity. Doesn't necessarily have to be a county staff. It could be contracted staff or contracted work with a health and human service agency locally, and it is not intended to be oversight or overseen by a law enforcement agency, by the sheriff's officer or police department. It's intended to be an entity that is not overseen by law enforcement, but is partnered with health, human, and social service entities. The next one, better align available resources with emergency response needs by establishing a pilot program for non-emergent calls. This is a recommendation in the sheriff's office to hire a few civilian staff to handle civil complaints, minor motor vehicle accidents, traffic complaints, property damage complaints. This is similar in the sense of it's a non-uniformed officer response. The intent is to hire a few civilian staff to see if this is an effective method. It also can free up uniformed staff for more urgent response needs. Collaborative recommendations. So as you can see, there's a color code here. Blue is the city, green is the county, and this blended blue and green is a collaborative recommendation since this was a collaborative response. Identify a new curriculum, redesign it, and implement a culturally responsive training program that incorporates de-escalation, mental health components into a comprehensive response of law enforcement. So this is really identifying and building upon the training that has been effective and eliminating training that has been ineffective. It's intended to be a pre-field training program. So training that effectuates and is implemented with individuals post-academy before they hit the field and go into their field training program. It's about advancing a commitment to more mental health training and including mental health first aid for our law enforcement officers. This also includes publishing the training curriculum annually and those that attend it and continuing it throughout their entire career. It also includes an advocacy that New York State has to change its police academy training. It needs to focus a big component of its police academy training on de-escalation, anti-racism, anti-bias, history of policing, mental health first aid. Police academy training is the first introduction law enforcement officers have into the field, and that's the opportunity where you have to start the expectations and the cultural shift in this field. If I go down to the bottom a little bit, develop a comprehensive and inclusive initiative recruitment strategy for law enforcement and correction officers. This is about developing strategies to attract diverse talent pool into law enforcement and the correction officer field. It should involve in community feedback, community input, and community participation in an interviewing process, and how we outreach and how we prepare folks in the community, and how do we attract community members, particularly communities of color, to show interest in these career fields. Develop a comprehensive community healing plan to address trauma and the relationship between residents and law enforcement. One of the things that was very clear in the feedback that we received is trust does not exist or is minimally exists between law enforcement and community members, particularly marginalized community members. This is about effectuating a plan for community healing that acknowledges the past histories and traumas within the community around policing and law enforcement, a plan that lays a foundation for building trust with marginalized communities. It's a process that would recognize generational trauma experienced by our marginalized community members and communities of color. And it's a plan that also recognizes the trauma experienced by law enforcement officers as well. So this is, I think, an important piece of this as we move forward. And it's not, I don't know that it's a finite period of time. It's a process that evolves over time. Develop a countywide program to promote and support holistic officer wellness. This is about developing similar things like a peer support program, as well as ensuring that our law enforcement officers have the mental health resources and physical and healthcare resources they need to perform their jobs to the best of their ability. This would be a countywide peer support program. Mental and physical wellness should be a core tenet of this program. It should be proactive. It should talk about preventative initiatives, and it should be stressing the mental and physical wellness of the profession so they can serve the community in its best interests.
Thanks, Jason. So yeah, next are all about data, and data as it relates especially to accountability, right? You can't, it is hard to improve what you are not measuring. That's what my doctor said when I get a scale. Well, improving a department and improving service delivery, especially when it relates to equity, you have to actually be measuring. You have to know what your outcomes are if you're going to improve those, if you're going to adjust. And so the first one is all about adjusting. If we standardize our data entry and review our existing data sets for more actionable insights, then particularly the decision makers, the Common Council and the county legislature, can make better, more informed decisions about where we need to invest our funds and our people. The second one's especially about the community, developing a real-time public safety community dashboard so that we can go on, anybody can go online and find out in real time, week to week and month to month, what are the police department and the sheriff's department, what is keeping them busy? What kind of stops are they making? And particularly from an equity lens, is the enforcement equitable? And is the public safety response equitable? Is every community inside the city, for example, getting an appropriate and speedy response when they want one?
Thank you. I'll take the last one. Collect and evaluate results of officer-initiated traffic stop enforcement. So in this country, on an annual basis, you have over 20 million traffic stops annually. Generally, this is probably the most common interaction between the public and law enforcement and the average person. And it's documented across the country that traffic stops have disproportionately impacted minorities. We don't collect demographic information right now for traffic stops. We need to start collecting that information. We need to start assessing and understanding as the method in which we do our traffic stops impacting our community members differently, especially our Black and Brown communities. And if so, how do we change that approach and change that process? And even asking the questions of should we really be doing traffic stops anymore or not? So this is a data collection and then analysis perspective to understand the effectiveness and the impact of traffic stops and how we're doing it. It also includes a review of intersections from a safety perspective. Are there a lot of accidents at intersections where many times our law enforcement do traffic enforcement? And if so, can we make physical improvements to that intersection so that no longer has to be patrolled or enforced by law enforcement from a safety perspective? I can take this if you'd like, Mayor. Repurposing the SWAT vehicle. This has to do with shifting the SWAT vehicle for two reasons. One, shifting it up to the Department of Emergency Response, which is a county department, and really not having it be a focused asset for SWAT purposes, but really having it being a mobile command center for different types of instances, emergency responses needed in the community. This should not be a specialized law enforcement asset. It should be an asset that can be used by different departments, different agencies. For example, during this pandemic, we could have used this vehicle for mobile testing sites, mobile vaccination sites. These types of initiatives is how this mobile command center could be used moving forward. Conduct a review of the SWAT callouts to determine the appropriate use of service and equipment. This is evaluating the past several years of SWAT callouts to determine its frequency of use. Was it appropriate? Was the level of service adequate? Was it inadequate, or was it excessive? And then really understand what type of level of service do we need with respect to specialized training moving forward.
As next set of recommendations are all things that we'd like to see changed, but is not immediately inside this community's power and would require changes to state law or state operations. So we bucketed those together. The first is an ongoing and responsive collaboration from the New York State troopers, particularly the troopers that operate in Tompkins County, to make sure that their values and their priorities are in line with ours and that we can collaborate when necessary. Next is to advocate for New York State to grant local civil, to grant us, the people who do the hiring, the communities that do the hiring, give them more flexibility. This is this recommendation and the next one, to do continuous recruitment of eligible candidates and to revise the civil service exam process to diversify law enforcement. So the limits on when and how we can recruit people and the limits on who we can take based off of how they do on a standardized test are keeping a lot of very good people out of this profession and preventing, it's not just our police, but it's preventing our police department from becoming more diverse. We think if the state made those changes, we could recruit and retain the kind of diversity that we'd like to see in public safety. And then finally, this is a change to Civil Service Law, Section 75. I'm sure you all know and have experienced how difficult it is for communities to hold officers accountable, especially for fireable offenses. There are things that would get you terminated in any other job really in the country, unionized or non, that it is very difficult not only to get the termination, but to get it in a reasonably efficient manner. Instead of after 3 years of being on the public payroll, when there's an obviously a terminable offense, we would like the state to reform that to give municipalities the power to act more quickly to enact discipline. And then if the union and the officer would like to grieve it over a years-long process, they can do that, but not while on the payroll. This next one, I'll take the top one, which is the City of Ithaca Community Police Board. I think it was Nicole mentioned that she's served some time on that board. It does good work, but it could do far better work if it had more power and more authority. So more power would mean investing more in the board, and more authority would mean making sure that right now they make recommendations, right? Recommendations around commendations or recommendations around discipline. And those recommendations need not be followed. They don't have to be listened to. And in fact, nobody can be compelled right now to come and give testimony or evidence to the community police board when there's been a complaint about officer conduct. The report is recommending, and I support this recommendation, that the community police board be given more teeth, more power, so that they can, instead of just recommending discipline or commendations, they can actually execute on that discipline or commendations.
And I'll just second that from the sheriff's perspective. There is no police oversight board or equivalent thereof for the sheriff's department. This recommendation is suggesting we create one that can have oversight over the sheriff's activities and serve a similar function to what the mayor just spoke about the community police board from the city of Ithaca. The bottom one here, require public disclosure of district attorney and assigned counsel statistics. So right now, everything's been talking primarily around law enforcement and mental health, but nothing's been talked about the prosecution or defense or public defense of individuals. What we're talking about is having more statistics around the demographics of cases, their prosecutions, their outcomes and dismissals and so on and so forth. That is information that's not publicly disclosed, that should be disclosed so that we understand how the criminal justice system is both defending and prosecuting individuals. Lastly is the recommendation on how to implement this. And this is the development of a community justice center. And I guess I'll put it into a slightly different context and how we viewed trying to go about this work. As we've responded over the past year, and believe it or not, it's almost one complete year that we've been in full COVID-19 response and pandemic mode. And this community has fared well, better than most in terms of low infection rate, high vaccination rate, and being able to communicate to the community on how to do so. The only reason we were able to do that was because we put the human resources and the money behind combating and managing the pandemic. And if we want to make a movement on this, we want to be able to move the needle, we want to be able to show results, then we have to treat this as a similar pandemic of inequity. And we have to be able to put the human resources and the monetary investment to making those changes. This community justice center is about hiring staff committed solely to moving forward the recommendations in this report. It's about putting financial resources, hiring staff, and then having them work with the different departments, different agencies across multiple jurisdictions to be able to achieve these outcomes that we've identified here. And I think, frankly, as this begins to develop over time and this document continues to change and our efforts continue to change, continue to put the resources behind that to see it move forward. We view this from the perspective of a pandemic of inequity, and if we're going to make substantial change, we have to put the financial resources behind it to do it.
So what's next? What's next is that we're in this phase where you see the first bullet point now. These recommendations are now formed. You can read them in more detail. There's about 100 pages with 12 or 13 appendices on the city and county website. And we want feedback. We want to know, are we headed in the right direction? This is obviously, in Ithaca, there are more opinions than people, right? So if you poll 15 Ithacans, you're going to get about 24 opinions. So we knew when we set out, we wouldn't be making everybody happy, but we still need to make sure we're on the right course. We want to find out from you. We'll funnel all these recommendations made by you and anybody in the community towards the legislative bodies, the county legislature and the common council, who will vote on this by April 1st, with another reminder that this is a living document, that even by April 1st, once adopted on April 2nd, we can begin again with And we will begin again on ongoing community and public input feedback. Then the implementation process, which Jason summed up very well.
So I think that wraps up the presentation for the most part. So I guess I would pass it back to Dominique and Dr. Nunn and go from there.
All right, well, first of all, thank you for that. Second of all, also just have to be very frank. We have a few minutes, so we're gonna have to have longer conversations because this is scheduled until 5:30, and it's 4:45 right now. So I wanna be able to just put that out there that this is an iterative process and we will provide space for folks to be able to continue to have these conversations. So don't feel you have to throw everything out today or that if something is missed, it won't be sort of pulled into this feedback loop. So with that said, I do want to acknowledge time and open the floor for folks with, can you hear me now? Am I louder? Oh, okay, perfect. All right, so I want to open the floor now for people to ask questions. I will say that, again, I'm happy to be here as long as we need to be here, but do want to be respectful of other people's time if that's the case. So we'll ask some questions from the floor right now, and then we'll go into, I have some questions that came up in the chat that I can also bring up as we're moving forward. So I'm passing the mic to whomever wants to take the mic to ask those questions.
I can go first. Nicole here. I have a ton of questions, but like you said, there's not a lot of time. One of the questions I have is throughout the slides, a recommendation, I think the next time, stopping after each slide so folks can ask questions because there was a lot of information to be able to take in. So right now, I'm thinking, was that slide 1 or slide 3? But either way, I'm wondering if Jason or Mayor Svante would be able to answer which of these recommendations that you all have put forth will respond, resolve, or reconcile racial profiling. If I'm thinking about Kaji and Rose, the young men a few years ago who were held at gunpoint, I'm not sure I see any of these 19 recommendations actually being a solution to racial profiling. Another question really quick I had is, as I look through the case studies and the models that you use, I'm wondering what the statistics are regarding the success rates. I saw that Cahoots had specific statistics in terms of seeing a decrease in police involvement, but the other cases or the other states that you all use didn't have specific statistics. And LAPD was the first one that you all listed, and I thought that was pretty fascinating, given how much corruption, police brutality has taken place with the LAPD. So my 2 questions.
Yeah, good questions. Thank you, Nicole. I'll take a first crack at it, and then Jason, if you'd like to go. You're right. So preventing racial profiling and racial bias in general is the goal of the 19 recommendations in total. I don't think any one is going to do it. I think this is a problem that is so complex. We have to attack it from all the sides. The accountability recommendations, right? Making it easier to terminate officers that we find evidence when we find evidence of bias, right? Combine that with the recruitment, right? Recruiting folks from the jump that not only do you have to do screening for bias, but recruiting people who are from the city and from the community who have more how to say this, more cultural exposure, right? So that they are familiar with the community before they start policing it. Combine that with training, right? Combine that with data so that we can see on a meta picture basis, because sometimes profiling is hard to spot on a case-by-case basis because there's always a reason, right? No, I saw something in his hand. No, I saw littering. No, I saw this. But on a meta basis, it's harder to deny. So if you combine all the recommendations around measuring all of your data, improving accountability, doing better training, doing better recruitment, having a residency requirement in the city, which is embedded in recommendation number 1 for officers who are just beginning to work in the new department. Those together should reduce the incidence of racial profiling, which I'm sure everybody, myself included, have been a victim of. It is a word that came up a lot in the data in the focus groups is dehumanizing. Really a dehumanizing experience and traumatizing.
I would second that, Mayor. One thing that that I think would also add along with that is, and it comes to the accountability piece. The police oversight boards add a component to it, but also has to do with the hiring of leadership in both organizations and what the expected culture is. Training is important, but it also has to do with holding our leaders accountable in both those departments to ensure that they're practicing their benefit. They're demonstrating the appropriate culture. They're demonstrating the behavior, and they're holding their staff accountable for that. So I agree with Svante. It's all of these elements together and attempting to bring equity to the way they police. If I can jump to the next question, and this had to do with results or data results from some of the different scenarios that were put in. I think it was Appendix 1 or Appendix 2. And that was really meant for a broad research perspective of understanding what are some other alternative methods that different agencies have looked at. And I think to your point, there was one with respect to what the Los Angeles Police Department had done, understanding some of the tenets of it. We didn't feel it was necessarily anything we wanted to pursue, probably much more than glancing over what the parameters of that approach were, where we really started to see positive results and something that we felt was more relatable. And frankly, what we had feedback from members of the public was something similar to the Cahoots model in Eugene, Oregon. And some of the statistics around that, where they really started to see a diversion of calls from law enforcement to a health and human service response model or an alternative response model. Anywhere between 8 to 20% of the calls were diverted depending on need. So for us, that's where we gravitated towards. We didn't feel, and frankly, the feedback we got wasn't in line with some of those other models that were out there.
All right, so Nicole, I just want to check in. Do you feel that that was a good enough answer for you to be able to move forward at this point? Because I do see other hands being raised. I know you had a few different ones, but we definitely can circle back.
There are other people in line, so I don't want to take up all the time. I would push it more than gently back against the training. When I was on the community police board, I worked with Seth Murtaugh, and he wrote a grant. I can't remember the specific agency, but we had folks come up and do this whole training with IPD on racial profiling, implicit bias, and having sat in that 2-day session, there was a lot of pushback from IPD around implicit bias, it being real. Ms. Schelley Nunn was there. So yeah, thank you. Thank you for checking in, Dominique.
All right, well, we will circle back. So just keep it in your brain. I do want to acknowledge that I was wrong. My calendar invite says 5:30. We have till 6. So just to let you know, I want to flag that. I don't want people feeling rushed. I'm going to go to Dr. Russell and Mama Phoebe. Is it okay if I call you that as well? I want to just be, and then we'll go to Mr. Amos. So that's where we'll go. 1, 2, 3.
Yeah, with your permission, I'll just take about 3 minutes, recognizing that we probably won't get too many opportunities for multiple comments. I mean, I do have a question. The question is not for the mayor or for officials, but the question is for folks watching this, particularly everyday working folks and people of color watching this at home. And the question is, in a white supremacist society, can you have anything but white supremacist policing, right? Let me just make a couple of points. I'm a member of an anti-racist coalition, Tompkins County Anti-Racist Coalition, that is formed last year, and it's made 3 basic demands. We have a demand letter. I'm not sure that folks can see the chat, but I put the link in the chat. The 3 demands were to defund and shrink policing, cutting IPD budget by 80%, to demilitarize and restrain police by removing tasers and other oppressive weapons, and transferring the SWAT truck to poor and working class people so that they can decide whether it should be a mobile health clinic or something else. And finally, to rebuild community by reinvesting in youth services and expanding funding to the social programs that actually keep us safe. We also demanded reparations to Rose DeGroat and Kaji Ferguson for the trauma they experienced during the brutal police attack on the Commons in April 2019. So, I mean, I think as has been already acknowledged, we wouldn't be having this conversation if it wasn't for the popular uprisings that followed the George Floyd and Breonna Taylor murders. And the movement that arose internationally and right here in Ithaca demanded defunding of the police. And I think that we need to continue to center defunding, right? The primary demand was not different policing, it was less policing defunding and depolicing remain the primary goals. People recognize that police cannot reform themselves, that the institution of policing itself is rotten, that the expansion and militarization of police has increased, right, in recent decades, while the social services and programs that actually keep us safe, the programs and the social spending that actually keep us safe are slashed. So we can't talk about reforming public safety in the context of an austerity budget. Is reimagining public safety a genuinely progressive reform? We should distinguish between reformist reforms and non-reformist reforms. Very briefly, reformist reforms are reforms that actually strengthen the existing system or make it appear more legitimate. Non-reformist reforms shift genuine power and resources back to the people and begin to take us in the direction we want to go as a society. So the question is, will reimagining public safety take us closer to where we want to be as a society? Or is reimagining just rebranded, right? Is it putting lipstick on a pig? Is it an attempt to distract us from the popular demand for public defunding? The point is that policing itself is the problem, right? We have to reject reforms that increase police presence, scope, surveillance, and budgets, right? Any conversation about policing that does not center defunding is dishonest. Now, last 30 seconds, phrases such as strengthening police and community relations are misleading. Communities of color don't need stronger relations with police, right? They need far, far, far fewer interactions with police. They don't need to be in cahoots with police. They need the material resources to control their own destinies and transform their neighborhoods. We don't need to rebuild trust between police and communities of color. This is deceptive. Who needs to trust police, right? I mean, who the hell would trust police? We trust police to continue to serve the interests of white supremacy and capitalism, as they have always done. We don't need more diverse police, right? Black and brown cops shoot and kill Black and brown people too, all the time, right? In a white supremacist society, the only way to police is white supremacist policing, right? So it's his institution with a long history of brutality against marginalized and oppressed people. So I would just invite folks to check out the link that I put into the chat to the Anti-Racist Coalition demands. And let's build this movement from the bottom up.
All right, so one, thank you for that. As a neutral person here, I want to give chance for sort of other community folks to weigh in. I see hands raised, but I do want to flag for Jason and Svante, like, talk about this in thinking about the proposal that you have, because there is a proposal here that we are weighing in on, and this seems to be real questions are being asked within the framework of either the proposal or beyond the proposal. So can you speak to that a little bit for folks who are watching? And then I do want to give it to Mama Phoebe, Mr. Amos, and then it looks like Harry is what Svante put in the chat. You have two Deanna nuns here, so.
Yeah. I sent my link to Harry, but I think we'll be.
Oh, okay. Well, we got you third, Harry. So, Svante, Jason, do you want to weigh in here? Thank you, Dr. Russell. And then we'll go back to the rest of the hands.
Sure.
I know I appreciate Dr. Rickford's statement, and I want to respect that it wasn't intended as a question to the two of us. I mean, I will just say that I think the proposal will decrease the militarized footprint of policing and increase positive interactions with city employees, which I think will be a good thing for the public safety of the community.
I think I would add is that a lot of the recommendations talk about less contact with police and law enforcement and the public, and instead providing the social support systems that I think have been mentioned by Dr. Russell. And I think that achieves that, particularly with the alternative response. I will say that some of the data and feedback that we got from the focus groups acknowledge that there is a need for law enforcement in certain situations. And I don't know that there was consistently said that it needs to be abolished. It needed to have a smaller footprint. It needed to have less frequent response. And in its absence, it needed to be replaced with a more health, human, and social service response based on those needs. So that was based on some of the data that was received and from some of the focus groups that participated in the process. I understand, and I've seen the request and the letter that was shared in the chat. I know it was looked at as we went through the recommendations. So I acknowledge that we received it and we looked at it and read through it. So I think that's all I have to add to it, other than the recommendations do recognize and make an attempt to, I think, put the right services in the right places. And a lot of that has to do with removing law enforcement from responding to a lot of these types of calls.
All right, so I'm gonna push back a little bit there. How? I think that's what people want to know. If you are moving, what is, I guess, and you can talk about the process, because it could be that we talk about this further along, this is the feedback section, we go to process, but how does this happen? You know, if you're reducing and the budget concerns, how do you do that? And what does that look like? And who's impacted and how? I think that's what's missing.
So I think if I talk about the alternative response model, you know, this is a 12-month process that we've identified to understand what level of investment needs to be made to be able to respond to health, human service, social service, mental health calls. Those are calls that would have to be dispatched. The information would have to be gathered at the time of those calls, and it would be dispatching a non-uniformed or a non-uniformed either mental health professional or healthcare professional. That's different than what we currently do now, where in most situations you have a uniformed response. We do have a mobile crisis team. The mobile crisis team is available to anybody in the community. It's 24/7, and they respond to many of these types of similar crises now. It's not funded at the level that this would be, and it's not covering a wide range of other health and human service calls. It's generally, covering calls of severe crisis, and many times they have to respond in partnership or in support by a uniformed officer just due to safety reasons. So this is really expanding that, not just to crisis circumstances, but a lot of times general calls that law enforcement responded that don't need to. So in this instance, it's investing in an alternative response that would take calls away that are done by law enforcement now, but responded by a non-uniformed responder. And they have a different skill set, a mental health skill set, a social service skill set, and not a law enforcement skill set.
I think that's important that alternative response starts at the frontline everyday level and goes all the way up to most intense interactions, which would be SWAT ones. And I think we heard two different strains of feedback when talking about SWAT. One is that folks felt like it existed to intimidate, and even if it didn't exist to intimidate, that was the effect that it had. And that depended on whether or not they were coming from a historical perspective, recognizing that many SWAT teams in the US were created in the 70s and 80s to put down uprisings in cities. And others, even if they didn't have that historical perspective, they may have a lived experience of seeing the SWAT team operate in their neighborhood to serve no-knock warrants, for example. On the other hand, we had folks that said, but we are aware that there is actually, there are more guns than people in this country, and an increase, parabolic increase since the Columbine school shooting of mass shootings. So how do we maintain a tactical response for situations where it actually is needed, but not have a team that terrorizes and intimidates the community? That's where those recommendations came in about moving the truck, but also taking a look at all of the past calls and putting real bounds around its future use.
Thank you. So Mama Phoebe, you had your hand raised for a while, your virtual hand. So I want to go to you, and then Mr. Amos, and then Harry. You're on mute.
Okay, I have a few things to say as always. First of all, I want to start by clearing up this notion about Ithaca is leading, and we're doing such a fabulous job and great job. Please don't do that to us, right? Because that's starting off in a false statement. We're not leading nothing, right? We got lots of work to do here, right? So that's one thing I needed to say, because that just shook my whole world, right? Also, I'd like to, I didn't hear nothing about reparations for people who have been violently hurt because of the police system. I didn't hear nothing about the history of policing. So I think we really need to talk about that, right? I think we're jumping out there without even going to the root. The history of policing was to capture the indigenous people and to also enslave Black people, right? So, and so I don't know, I think that conversation is very important to me that we do. I'm also someone, thank you so much, Russell, but I'm real clear about this whole reform thing. Like, how do you take out, I know for me, if I have a piece of equipment that doesn't work, I don't keep bringing it back in. I can't fix it, right? So I'm real happy to see as many of us on this call as I do, and I'm happy that we're reimagining something, but that sounds kooky like. I need something harder than that. Reimagining, I want something solid. I don't want to reimagine nothing. That means that's just my imagination going away with me, right? I want to hear something that these are the changes that's going to be made. We don't need policing in our communities. I didn't hear much about how we're going to focus, defund the police. And that don't mean abolish them. It means defund them and send that money to grassroots organizations that's already doing the work, that's already keeping our communities safe, right? How do we keep them in this conversation? How do we have a place like MRC, Southside, where people can walk in and feel safe? That's another thing. And when I hear this, keeping the mental health and the social services involved to be a part of this work, that's kind of scary because they work off of a racist system too. They need to be doing some changes also, right? When they work with us, they're still ingrained in a racist systemic way of how they do this work, right? So that's why I think it's really important that we keep, when y'all making your plans and talking about stuff, figuring out ways how we get our grassroots organizations to keep our community safe, right? Because I don't think we're ever going to get to a point of policing in a way, there are some organizations that have policing in their community. Black Panthers had a really good idea of how we should protect ours. And that's what's important to me. If we're talking about Black and brown communities, then we need to look up the history of the Black Panther Party and the way they thought it was important to protect our communities. And that's it.
Wow. So first, thank you. Second, I've never meant to offend you. Let me clarify. Leading the way in, y'all are one of the first to think about even putting anything on the table, because what you're talking about is like racist systems, racial systems, all white supremacy, all of that. People are stuck. They haven't even had the tipping point of this, even if the impetus came from the uprisings or they came from some of these spaces. This is a collective, I guess, movement at this moment that, for what it's worth, it's been done. But I don't want you to feel as if I'm saying y'all are leading because these are the
because we're not. Because we're really not.
Right.
Because if you check out Harlem, they got some powerful stuff going on. I have a sister there who's stopped the violence, all kinds of stuff. So I just don't want us to kind of
complacent with this. No. And I don't want that on the record.
If we're leading, then we don't need the help we need.
No, I wouldn't say that at all either. I just want to say that this is something that's coming out, and people are, whether or not it's buzzwords, whether it's not, things that seem Pollyanna. It's the first time that these things are being talked about on the national scale in this way. So that's just the way it is, and it's in this way for the systems that are upholding this white supremacy piece.
Okay.
So so I want to just be clear. It's not, people have been doing this. They're doing it well. Let's open the door to get more of that stuff going, if that's what community is asking for. And so I think this space is for you all to have those conversations and have Svante here and have Jason here to talk about that process, about if this isn't meeting your needs, and if this isn't what it's, if it's not given what it's supposed to be given, then what is it supposed to be given, and how do you get to that point?
And that's first change it from reimagining, because we've been having this conversation in Ithaca since I arrived on the shores of Ithaca in 1993, right? And I'm not going to hold this up. I'm going to mute myself, but thank you.
No, we got you. So let's give the floor, to Mr. Amos. He had his virtual hand raised, Harry, and then Jason and Svante. This is, y'all are bringing this to the folks. You got to step in, tell us, give us something. They want to know.
Yeah, for sure. No, and I'm appreciating the feedback so far. We'd love to hear from Amos and Harry, and then respond as I can. Though I also do want to note that if you see me take notes of it, if every time my computer is bouncing, it's because I'm typing on it. So I'm taking these notes to help share the feedback too with council.
I would just say that Phoebe's comments, I think, are on point with respect to this isn't just about law enforcement, it's about the whole system in terms of ensuring that we're addressing systemic racism in all of our systems, whether it's social services, health and human services. One of the conversations we had, and this may be trivial to some, but it was a point of conversation when we were going through this process. The executive order says New York State Police Reform and Reinvention Collaborative. We purposely identified it as reimagining public safety because we felt this is more than just law enforcement. This is our health and human service and our social service networks that also have to be able to address and eliminate inequities in the way they provide their services. So I agree with Phoebe on that perspective. This cannot be limited to law enforcement. It has to expand. And frankly, I don't know how we can look at an equity lens through just one department and not look at it through all of our departments as a government. So I agree with you on that, Phoebe, and just want to elevate that's a conversation we've had as we've gone through this process. But that's all I wanted to say. And then I know Amos and a few other folks have something to say.
Good afternoon, everyone. Thank you all for being here. Just a few quick questions. I'm just listening, learning more about what the plan is or should be, and the different comments. One of the things that stuck out to me in this whole thing was that there's no oversight board at the sheriff's department, which is troublesome. Very troublesome, since with the gentrification that's going on, you have the black and brown people that are getting pushed to Groton, Enfield, Lansing, Newfield, Danby areas, where the only police they're going to be in contact with if something should happen would be the sheriff's department. And certainly there's no one in any of the patrol cars at the sheriff's department that are black and brown. And so I was trying to figure out how are we going to change that, number one, and be very specific about it and not use white women as the minority for the saying that they're hiring minorities. And, a white woman is not a minority when we're talking about things of this nature. And also with the DA's budget, but we won't even get into all that. And then my question, because we're short on time, and I know we're going to do this again, but because we're short on time, to Mr. Molino and to the Mayor Myrick, how dedicated are you all to this? Because it's going to go on. You're going to get a lot of pushback, but how dedicated from a personal standpoint are you to seeing this project through, whatever it's going to come out to be and whatever it's going to look like? Because most of the time you're gonna have to break peace to make peace. So with your constituents and all of those people that are saying no, I think a lot of people have just become complacent with their positions and don't want anything to change. So how dedicated are you to that, and are you willing to stand up when you're not on the Zoom call with us behind closed doors? What are your plans?
Yeah, Amos, if I could just, Mayor Fatari, if I could start, to your point about communities of color outside the city and the sheriff's office and oversight board, you're 100% correct. Communities of color are are increasing in population outside the city. And you are correct, there is not a black or brown sheriff's deputy on patrol. Those are two facts. And the oversight board recommendation, so there is no oversight board right now for the sheriff's office. That's why it's a recommendation. And it's specifically stressed as being an independent oversight board. Now, there has been some pushback because the sheriff is elected, and I know my perspective has been, as the group, is that doesn't matter. An oversight board is meant to have transparency, and it's meant to effectuate immediate accountability, not an accountability on a term limit. And that's not a criticism of the sheriff. Sheriff Osborne and Under Sheriff Olin have been great participants. They, I think, are very committed and have been demonstrated their commitment to continuing to improve that department and supporting the constituents in the community. But an oversight board is what we see a lot of feedback on. And regardless of whether it's an appointed or elected head of the law enforcement agency, transparency and immediate accountability is something that is warranted and I think is expected. So that's why that recommendation went forward. It's not, there are some folks that don't care for it. Nonetheless, we recommended it. As far as commitment, and I just want to say this, and I don't think we've talked probably for 6 or 7 months now, Amos. And I'll see you probably next week at the Human Rights Commission presentation. So twice in less than a week. This executive order said the chief executive officer has to recommend a plan. I'm the chief executive officer for the county. I'm not elected, I'm appointed. The mayor is the chief executive officer for the city. We put forward these recommendations. We authored, well, we didn't necessarily put pen to paper. We took in a lot of recommendations. It was from community members. It was from the law enforcement agencies, from the district attorneys, all these other partners and community partners. And we said, this is what we're hearing. This is the feedback we're getting, and this is what we're supporting. In the next week, we're going to put some financials behind it to go to the legislature. And my comment to the legislature is, as far as my perspective on it, and I think the mayor shares the same, these are two pandemics. We have the COVID pandemic and we have the inequity pandemic. If we want to make a serious effort like we did with COVID, which is a public health pandemic, we had to put human resources, meaning people and money behind it. And that's what we're recommending. So that's what I'm bringing for the legislature. That's what I told them on Tuesday night. That's what I'll continue to tell them as we go through the process. It's now up to them to adopt it, to change it, to enhance it, to subtract from it. That's their job now. They have to adopt it. So that's my commitment to it, to the extent that I can influence it.
Yeah, and I'm as committed. Amos, I appreciate that question because it channels so much of what we heard and what urged me on to the fight ahead of us. I mean, it's not, the work ahead of us is not, I got texts from mayors all over the country saying, good luck, that the work, they couldn't believe that we would release a plan if the union didn't support it. Because just politically, it's not a winning issue. And I know I've heard from some people who are like, oh, well, you only like this plan because it'll help you. It's so progressive that it'll help you politically. To which I just want to say, let's think about this, folks, for a second. If a plan is too progressive for Ithaca, where is it helping me politically? I mean, this is the most, so, but choosing to move forward anyway was in part because I wanted to let the people know who participated in this process, who shared their experience, that we were going to take it seriously and make as deep a transformation as we could towards justice. But I also want to move this far because I live here. I mean, you can't be more committed than to be a Black person. My mother lives here. My brother lives here. I live here. My mom always said in a bacon, egg, and cheese sandwich, she said the chicken is involved, but the pig is committed. And I'm committed because I live here. I mean, this matters to me. I want to live in a community with a Department of Public Safety that we can rely on, that we can trust, and that will actually enhance community safety and community building. So I'm committed, man.
Thank you.
All right, so I want to jump over to Harry, and then I see Kayla, your hand's raised, but also Dr. Sean, I would love for you to come in and talk about the process of sort of this community working group piece, because I don't think people have heard from that as well. So I'll tag you in third. So we'll do Harry, Kayla, and Dr. Sean.
Hello. I have more of a statement than a question. As far as the slides and everything else, it was too much information. This is like way beyond common sense. My thing is, we have a long history of everything being taken from us, everything being used against us. The biggest thing we could do right now is take the money and invest it in fixing our people. The police thing and all that, yes, a drop in the bucket, because you get rid of the police, you switch it up, you change it to whatever. We still in the same situation. We're still finding ourselves getting in the same shit. If we don't take the money and invest it in upward mobility for our people at this very moment in time, instead of waiting and speaking about damn trucks turning into medical whatever, what is that going to do? Every idea that I'm hearing right now is doing nothing for us. I'm not that scared that I care about the police that much. So you guys can worry about that. I'm worried about my people getting jobs, my people having careers, my people having opportunities, my people having food, my people having clothing, shelter, the same opportunities as everybody else, if not more so right now. So this whole police car thing and everything else, I don't know. You guys can figure that out. It looks like too many numbers to me to be worrying about that when I have to worry about everything else that's going wrong with us right now. Some of it is our fault. We need to come together. We've had so many years of being split apart from each other so much to the point where even if you take away the police, if we have nothing and we're out here with nothing, everybody's going to strive to get something somehow, some way. It's the only thing that makes sense. So if you are going to do whatever, I would suggest to defund or take whatever money and actually invest it into Black people's futures. And that's it. That's all I got to say. Thank you.
Thank you so much. So before we pass over to Kayla, responses, Jason or Svante, or do you want to just keep it pushing?
I think it's okay. I appreciate Harry weighing in, and the true fact that social investments reduce crime more than crime prevention investments, and that communities are stuck in this trap created in the 80s, in which the only way for communities to raise funds is property taxes and sales taxes, and not progressive income taxes. So while the federal government starved those social programs, communities, the only way to feed them is to grow your tax base. So there are places like the university that have an enormous amount of resources and are not taxable by local property taxes. And whenever Professor Rickford wants to come to Day Hall with me, I'm happy to keep that pressure up on getting more equitable resources from the university so that we can increase our, because Harry touched on something that's true. I mean, you could take the entire amount of funds from the police department and spend it on social services, and you're still not scratching the actual deep needs for more affordable housing, universal health care, great education, good food, healthy food, organic food.
It's a good start though, Mayor. $12 million is not a drop in the bucket. It's a good start. So let's be very honest about the proportion of the Ithaca budget that's consumed by the IPD.
Sure. Happy to be very honest. I'm always straightforward with my numbers, including the fact that Cornell University's $7 billion endowment, could be put to better use supporting people locally than earning more interest in the bank account.
Couldn't agree more.
Would you quickly be able to?
That is not on the Ithaca budget.
So I want to stay because I do see hands raised. Nicole, I do see you, so I want to get to you. Thank you for that. Thank you, Harry, for sharing. Kayla was on the screen. So Kayla, Dr. Sean, Nicole, and it looks like, I want to say Yasmin, but it's labeled as the one. So I remember that was, I think, the name. So There we go.
So I guess my overall question is, well, I agree with Harry and with Russell. I don't think abolishing the police is really what needs to be done. It's more so defunding, because we still, at the end of the day, we have to be honest with each other. We still have criminal activity going on in Ithaca. We have 2 unsolved murders. We have people getting shot. We have robberies occurring. So I just, in the plan, I personally don't see where those problems are still being tackled or even being touched upon. So if there's a way for you guys to elaborate or explain how you guys in your plan will actually like create a safer space in that sense for Ithaca, that would be great.
100%. I think that's such a insightful question, because, and it gets at the heart of what I think has been a false paradigm for too long, which is, if we want to solve crimes and prevent crimes, you need more guns and more officers. Or if you want a kind, gentle police department that doesn't hurt anybody, you need, you won't be able to solve crimes. And the truth is just the opposite. We solve crimes and prevent crimes when people know and trust the people who are entrusted to do that. Like, when you're resorting to, when somebody is killed in our community, or when there's shooting, or when there's a stabbing, there are dozens, sometimes hundreds of people who know who did it. And they're scared of the person who did it, but certainly they don't feel like they can trust the law enforcement agency. It's why so many agencies across the country have resorted to sort of investigations by press release. There was a shooting last night. If anybody has any information, please call us, send out a press release. A new department built from the ground up with a culture that encourages community engagement, particularly from those community solutions officers, could help build the kind of connections that I think Harry O was talking about and Amos is talking about. They can help prevent crimes in the first place, and when something terrible happens, can help us solve those crimes, get the guns off the street, get the shooters off the street before more shooting happens.
Yeah, I would add, the past 3 speakers mentioned about things, relating to housing, employment, healthcare. These are things that we would talk about, we would call social determinants of health, things that are going to help people advance and feel secure. Those are all investments that need to continue to be made. It's not part of this report, but I think it's ultimately linked to this initiative and this strategy. The mental health initiatives and investments in this report link partly to that. There are other things that both the city and the county do individually and collaboratively, and it's worth another conversation offline to talk more about it, and frankly, to stress more how we could do more about it. One that comes to my mind is the Community Development Housing Fund, where you have partners from the city, the county, Cornell, other municipalities that are they're contributing hundreds of thousands of dollars every year to affordable housing being developed, higher quality housing to be developed for our constituents and our citizens. So those are the types of initiatives that go on now, but need to be enhanced and need to be invested in more. So I would wholeheartedly agree when we talk about job training, investments, job creation, having them accessible to our constituents, having them accessible and helping our folks get these jobs locally. Housing and healthcare are also big components of it. Just want to elevate that these are things that I know we recognize and we invest in, but we definitely need to invest more in.
All right, so yes, Anne. So thank you for sharing that, but I'm going to push and say people want more. They want more transparency into that process and how they can be a part of that. So just lifting that up, that if you're going to say you're going to do it, you need to be showing that you're doing it. And with that, I'm going to ask Dr. Sean to sort of step in and just give some insight into what went into this process from like the community working group and any insights he can provide, because I know he was here to support the presentation. And then Yasmin, I think you had your hand raised, so I want to be thoughtful for that. You're on mute.
Of course. I'll try to make my comments quick. I know, like a lot of other folks here that have young people, I'm pretty certain my grandchild's going to try to jump in and be on screen in a minute, so bear with me. Executive Order 203 had a very interesting request, and it demanded that communities pay particular attention to communities of color. And so for lack of a better word, from a methodological standpoint, that meant that we went out to try to hear from as many communities as we could, and to then use qualitative research methods to uplift some of those voices, historically from communities that would not normally participate in a project like this. And so some of the focus groups, as an example, included returning citizens, people with disabilities, our LGBTQ transgender community, multiple focus groups with our Latinx community, including a separate focus group from our immigrant community, our community leaders of color, Black women, the Black community, Asian American community, Indigenous community, and the houseless community. And that is also above and beyond the individual interviews that were done. What happened from there, Dr. Gonzalez and I did not write the report. We wrote Appendix 2, so folks can take a look at the Appendix 2. And mostly what we tried to highlight for the folks who are writing the report is a couple of key tension points. First and foremost, no one has faith in the process. No one has faith in how we go forward, in large part because I think, as Ms. Phoebe said, we've been down this path since 1993. When, arriving on the shores of Ithaca, there's been significant inaction. And we, again, highlighted multiple reports from multiple different years that identified the exact same thing. And then there's this tension point that we sort of sell Ithaca as being progressive in word and rarely progressive in deed. And so we're trying to focus on that. So we tried to capture some voices, put some things together. I will say to Dr. Rickford as well, one of the appendices of our appendices was very clearly to highlight the demands from the Tompkins Colony Coalition of Anti-Racist Folks. So we tried to include a number of letters, demands, statements that were included so people can have access to all those. And we find ourselves at a very unique position, and that unsure how to proceed. I see this document in no way, shape, or form as perfect. I've said to Jason and Svante, repeating the words of other folks, that this has to be a living document. I don't know, we have to find a starting place, because to do nothing would, as I think I also read in the chat, would continue the brutalization of Black and brown babies. And as someone who has raised Black and brown babies in this community, I can't stand for that. So we have to start somewhere. And I also struggle with this idea of being a reformist or a revolutionary, trained to be a revolutionary, even while I find myself trying to understand how do we operate within this current structure. And I understand how deeply problematic that is, and still struggle about we have to do something at some point in time. So there was an attempt to do some outreach. This is a continuation of that outreach. We'll continue having dialogues. And I do want to highlight just one last thing, that on the report that people receive, it says draft for a reason, that the goal is to continue to change this document, to make it serve, in particular, Black and brown communities. But as we know, there are other communities within Ithaca that are equally brutalized beyond just Black and brown bodies. And so if folks get a chance to read Appendix 2, I welcome any and all feedback, and let us know what we did wrong. Let us know if we did anything right. What should we capture more? What should we highlight? I'm a 26-year resident of this community. This is my adopted hometown, so I'm deeply committed, y'all.
I should have started with you. I got off on the wrong foot with Mama Phoebe, not letting, I should have started with you. That's what I was trying to say, Mama Phoebe.
No,
that's what I was trying to say.
So Dominique, if I can, Nicole and I have this conversation. We both serve on the school board, and we have multiple conversations. And I say this lovingly, Nicole. It's usually when Nicole tell me what I did wrong and me trying to defend my actions, but it's holding me accountable. And that's what I appreciate, right? It's the constant holding accountable. And what Nicole said to me is, are we really leading the nation? And I said, yes. That if you read some of the other reports that are out in various communities, it's scary. With that being said, the bar is so low that we shouldn't pat ourselves in the back for doing anything. I hope that makes sense. A good colleague of mine, Luca Maurer at Ithaca College, says that Ithaca College is constantly recognized as one of the most LGBTQ friendly campuses in the nation. And Luca says, but that's because every other place is violently homophobic. So just because we're not on that spectrum doesn't mean we should celebrate where we find ourselves. And so I'm aware that what we're presenting is, in some regards, a low bar. I get that. And I'm also aware that for Jason and Svante, they're going to have a hard time getting this passed with their legislative bodies. And so I don't know how we need to help you all trying to be revolutionary and change this process as much as we possibly can.
See, I need you as my working train here. I'm getting there, but it's always because you are deeply committed to this community and you live here every day and you're here. And that's all I want to do is lift up your voice and your leadership there. So thank you so much for that. Miss Yasmin, am I saying your name right? Yasmin?
It's Yasmin.
Yasmin, all right. I'm here for you. And then I want to go to Nicole. I know you had something to say. And there are a few folks we have not heard from yet. So I do want to just lift y'all up. You're welcome to put a little hand raise thing or just wave your hand and I got you. So turn it over to you.
Okay, so I just want to make more of a statement. This by no means scratches the surface of what's been going on as far as addressing everything that needs to change within that policing structure. I do, however, think as far as the policing system goes, it is a start. We're never going to get everything that we asked for at one time. We're never going to get that. They're not going to give it to us that good. You know, white supremacy is not ready to lay that much of their privilege by the side just yet, you know, so it's going to take time. But on top of that, when we're talking about addressing things that happen that involve white supremacy, one of the biggest things that white supremacy got us to do in the Black and brown community is buy into it ourselves sometimes as individuals, and we start utilizing it as a weapon against each other, you know. So we have to hit this at all stages, because everybody at this point, whether we choose to do something or we choose to do nothing, we're all making a choice in regards to how this is going to be handled. And we all have to be accountable in real, true, effective change that will really make us the leading in the nation. And that's all I wanted to say.
Thank you so much for that. So I do, Nicole, I want to get to you, but I don't want to call y'all out by name, but there are a few folks who haven't spoken yet. So opening the floor to you as well after Nicole.
Thank you, Dominique. I wanted to go back to a point that Svante made earlier in terms of, I think it was in response to shifting funds that go into the police budget or defunding the police and feeling that putting that money into social services wouldn't have that much of an impact. So I guess my question is to both Jason as well as Svante in terms of if you both can speak to how many people within Tompkins County as well as Ithaca are living underneath the poverty line. Can you speak to the percentage of BIPOC folks that are living underneath the poverty line? So as we're thinking about having a job, getting your child to daycare, transportation, thinking about TCAT and where TCAT goes and where it does not go, and the fact that a lot of Black and brown people are now being exported out to places that are not safe for them to live, safe for their kids to go to school, and the buses only go there 1 to twice a day, they can't hold a job. So I think it's important to think about the impacts that these services would have on them. And I'm curious to what both of your perspectives are on what creates crime, because if you don't really have a good understanding of what creates crime, I think we will spin our wheels trying to deter crime when we aren't understanding the root causes. So if there's crime happening in specific neighborhoods, it tends to be because of unemployment. When we're thinking about the pandemic and how many of our people, Svante, for example, that work on Restaurant Row are unemployed because folks don't feel safe to go to eat out because restaurant owners, some of them are wealthy enough that they don't have to reopen. people were living in a pandemic prior to the pandemic, specifically BIPOC folks. So as we're thinking about how to prevent crime, it's giving them an opportunity to live a quality life. As we think about recidivism and how to prevent that, a lot of that is being able to come out of jail or prison and having those resources. So just wondering how you, Svante, and both Mr. Molino are thinking about resources and what people, specifically BIPOC people, need to live a quality life.
Yeah, sure. Yeah, I don't have the numbers right in front of me, but I know it's something like 75% of Black folks make less than a living wage in Tompkins County. And 100% of single parents with children under 5 are living below the poverty line in Tompkins County. And those problems are part of what I think that's what you're driving when you say, well, what is your theory of what creates crime? I think it is in part desperation, right? Poverty can also be toxic in a way. Surely there's a better word for it, but corrosive. Poverty is stressful and bad for your physical health. It's bad for your mental health. And it leads to a lot of conflict within families, conflict amongst neighbors, because that stress and strain is built up. There's another, though, category of crime, which is just what we define, and I'm talking about here, the war on drugs. What we've decided is criminal behavior. Chardonnay is not, marijuana is. And drug possession by some people is not, drug possession by other people is. So those are questions we have to break down. What I wanted to say, and perhaps I didn't say it articulately enough, it wouldn't be the first time, was that so long as there is crime in the community, you do need a crime response department. And so you have to fund that somehow. And you also have to find the resources to invest in other social services. It's sort of like our fire prevention. You know, we started doing a ton of fire prevention in the 70s, 80s, especially in the 90s. And our need for fire safety is way, way down, right? Because we changed our building code, we do fire inspections, we do prevention inspections now, right? But if in 1970 we just said we're going to get rid of the fire department and we're only going to do fire prevention, half the city would have burned down before it was safe enough to adjust those resources. But in the city that doesn't do an intense amount of social service spending, because the county does the social service spending, the city does more than our peers, more than peer communities by investing in GIAC and the Youth Bureau. And our spending in GIAC, the Youth Bureau, and Southside, as a percentage of our budget, has grown faster than any other spending that we do in the city, and it's not even close.
Jason, you want to jump in there, or you're good? I'm not putting you on the spot because I have more questions coming through.
Yeah. Nicole asked an array of questions, and I don't know that there's one straight answer for it. I think it's you're talking about the systems that support our community, and where is the investment and where is it not? You know, that's a broader, it's a large conversation. It's how are we investing our resources to impact the communities positively? So I don't know those numbers you asked for. They're good questions, and I don't know them off the top of my head. But you know, this is, I think, a conversation that needs to be continued. So I don't know if I can add any more than that right now.
I guess my question was mostly about how can we stop trying to respond to crime with policing, and how are we providing resources to prevent crime?
So I think, you know, and this is it's a multifaceted, I think, question and a multifaceted answer. You know, when we talk about, one of the things we've talked about, and it's something we need to continue to enhance. One of the recommendations is an alternative response model. I'll use that as just an example, and I think there's multiple facets to it. And when we have a response of an individual in crisis that can be done without a uniform response, or currently if it's a uniform response, there isn't necessarily a link to other services that the individual or individuals need. So it's a law enforcement response, and it may stop at that point after the issue is resolved. And a non-uniform response, it can have the warm handoff and the what we would call wraparound services. All right, this is an individual in crisis. What is causing the crisis, and what can we do to support that person to be able to manage and help deal with that crisis. And that can then lead to things like housing, things like employment, things like healthcare. And how do we connect all of those other social systems that we have and health and human systems to be able to link with that individual successfully, where right now it may not happen. That's one example where I think these are all intertwined and entangled. And to the point I think Phoebe made earlier was, that's great if you can link those systems, but if they're still dealing with inequities within those service providers, if there's still systemic racism in those providers, it's not necessarily helping us anymore, and we have to address that as well. So it's a very it's the ability to connect people with the services that they need, and it goes well beyond the law enforcement discussion. I don't even think I can give that. I don't think I can answer your question in such a short time of a response. So that's just an example of how we view that one recommendation of a non-uniform response to be able to connect with wraparound services that currently don't exist now. That connection. So that's all.
Thanks for that. What I will say is, like Nicole and like a few others that have been questions in the chat, there are going to be a lot of questions around this conversation, especially because you're offering, here are some reimagining pieces, but people are telling you, we need this. Why aren't you listening to this? So you're going to have some more concrete answers for what is this, because I don't want people to become frustrated that what you're offering is the only option. That's what the feedback place is for, but it also, you have to be clear that people want more than what you're given in terms of answers. And I don't know if you can answer those as well, just because, but you're sort of the leaders and that's what people look to. So they're going to keep pushing on these same things. Give us some actual deliverables here. Not to put you on the hot seat, I'm just saying. So I got a question that there were two that came up a long time ago, so I want to lift those up. The first one was around getting concrete into the community healing plan. People want more insight into that. So I want to give some time to that. And then the other one was around the preparations for addressing harm reduction and violence prevention within the plan. I think we've been talking around the weeds and the circles of that. So I'd love to lead with the community healing plan piece, because that's a piece of the actual document that people need to know more about. And then I want to open the floor up for more questions in the chat, but also for folks who have not spoken on the call. And I know we are coming up to time, so I do want to be thoughtful there as well. So the question for around the community healing plan was, they want to know, sorry, it always disappears as soon as I go to pull it. We're going in on the chat here. So the question here was, I would like to know more about the comprehensive community healing plan to address trauma and the relationship between residents and law enforcement.
I actually wonder too, Schelley and Deanna, this might be, if you're still there, might be also eating dinner. A good opportunity to hear your thoughts on this recommendation. And Jason, if you want to jump in on the healing plan.
I can start it, and if Deanna and Schelley can contribute, that'd be great as well. This is about acknowledging the past histories and traumas within the community around policing and law enforcement. It's about being able to acknowledge those circumstances, acknowledge how marginalized communities and community members in our communities have been affected negatively. And it's about recognizing the generational trauma that it's experienced through many of our community members over time, and in particular communities of color. And it's about being able to acknowledge it, recognize it, and being able to how we can put systems in place and put people in place to be able to move forward collectively. This I think is I don't think this is a finite recommendation with a start and an end. I think it's a continual effort, and this also feeds off of honest dialogue, similar to what you're doing tonight, and continued process with both the law enforcement community and community members in general. So I think this is a long process of trying to recover trust and build trust amongst law enforcement and community members. I don't know if Schelley or Deanna would like to add to that.
Yeah, thanks, Jason. That was certainly representative of what the purpose is. In particular, it acknowledges and recognizes the intergenerational trauma of Black people in this country, and that we, and how it affects us physically. So it's about really focusing and centering there. And in order for us to move forward, we need care for ourselves too. So that's a component also.
Just to add to the conversation, it's about the diagnosis. Nicole mentioned earlier, and I think Dr. Rickford did as well, you can't move forward until you understand the root causes. We're looking at the soil, trying to understand why the soil is bad, why we are putting in the similar, why we continue to make decisions publicly and look for different results. And so the healing plan is to get an accurate diagnosis of the soil in terms of our community, and then continue to move forward, specifically around racialized trauma. I wanted to acknowledge something that Dr. Rickford said earlier in terms of folks not wanting more interaction with law enforcement. With that specifically related to the healing plan, a lot of it has to do with distrust, which I think that has been unanimous in terms of the research. Folks on both sides said there was a lot of distrust. We cannot have a community where folks feel safe, period, if there is not a comprehensive healing approach. What that looks like is seeing folks for where they are and who they are, and dismantling those systems of oppression. And I think this speaks to the base level when we talk about soil. When people have talked about home housing insecurity, talked about wages, we talked about job loss, all those different things. All those are a part of the things that have to be included when we talk about being a part of a comprehensive healing plan. You have to understand where people's challenges are. You have to know where their trauma is in order to do that work. When you have a level of distrust that's this high, we can plan to plan. However, we will not have authentic or involvement in any way, shape, or form with if we don't have a plan to recognize and move forward. And so I see your comment here. Who wants to heal the relationship with the murders of Floyd and Breonna Taylor? The cops will never heal us, only brutalize us. I acknowledge your comment there, and we disavow in the strongest terms, or I completely agree with that statement in terms of not wanting to heal that relationship in those specific cases. However, if we're still talking about residents in our community, we have to acknowledge the work and then continue to identify how we move forward.
Thank you so much. Mama Phoebe, is that an old hand raise or a new hand raise? A new hand raise. All right, come off mute.
And Dominique, you had another question around harm reduction.
Okay. All right. So my question was going to be, could we do a circle of what does public safety mean to you? But I had to get off the floor from laughing when I heard about the police believe they don't trust us. They don't have to trust us. We pay their paycheck. They just need to do the job we asking them to do, right? But it's amazing that, I'd like to have a conversation. Like, what does that mean that they don't trust us?
Let me clarify for a second. Trust the process. I'm speaking back to the research. Yeah, I wasn't saying, you're exactly right. We're not asking folks who with lived experience to ask for trust. We're asking for you. We are here because people of color want government to work for them, right? If we have government, we need to be doing the job. So that's what I was speaking to. I wasn't saying that at all.
Okay. So. But I just wanted to get input from some people about what does it mean when you say public safety? What does that mean, right? For me, public safety means that I have decent housing, running water, some fur coats. No, I'm just playing. But public safety for me means that, I'm able to walk out my door, be greeted friendly from everyone or however. But what does public safety mean to individuals that's on this Zoom call?
And drop those in the chat, right? Because I do want to No,
Okay, go ahead.
like 6 minutes. No, I want people to drop that in the chat. 'Cause Svante is taking notes, right? So if you're taking notes, let's drop it in the chat. But I do want to lift up, so Rakim, I don't want to put you on the spot, but you here, and I just want to give you the space. Ms. Charles, you're here. Didn't hear from you. Space for you.
Yeah.
I'm like,
Yeah, I actually have something that I do want to say. It's more in tune with humanity in general, I feel. I feel like public safety, when it first began, you know, coming off my sociological mindset, you know, I feel like when it first began, as far as policing, they were security guards. They had they had something in their heart. They wanted to like make their community safe, you know, at one point in time. So my perspective is like, what is the hiring process as far as like getting these police involved? You know, because at the end of the day, I feel like some of these people who are getting in positions of power like that, they might need the healing more than us, because people of color, I'm a Black man in America. We have years and layers of pain and hurt that we've been through, that all we are asking for as far as a culture of people, as far as us as a people, is to help us heal, you know, help us heal, figure out ways to help us heal as a people. And I feel like this process is grown in that direction. I feel like we haven't started all the way completely over, but I feel like we started at a place where we need to start to build towards where we want to go. So my perspective is like, what I like, as I mentioned earlier, or what I just said is like, do we have a hiring process in place where we can actually know that those police officers are going to have the right mindset to actually go help heal the people, versus like, all right, as soon as I see you, based off your color, based off your aura or how you carry yourself, I don't trust you. So the trust comes in vice versa. Us as a people, we've been hurt through years, layers of pain, you know, and then we have people who get hired in places or positions of power, and they apply their microaggressive traits, their macroaggressive traits, and then next thing we know, we're put in a position where we can't really be heard because they're hiding behind the system. So what are we going to do as a people to really get people to understand, like, it's more of a humanity situation versus like, all right, it's just a race situation, you know? We need to really see these people and really get them to understand, like, all right, these people deserve better. So what could we do to help these people to get to where they deserve to be?
Such an insightful question. And I think on recruitment, I mean, so you, I really like where your thinking is here, because on recruitment, we found it so very important. And Schelley is here from our Department of Human Resources, who helped us modify our onboarding. And we now do psychological exams for officers, right, before they join the department. And you'd be surprised how many people, maybe one, how many people get screened out in those psychological exams. Right? When we, not just that, sorry, what's that?
what's in a psychological exam?
So you're screening for implicit bias as best you can, right? You're screening for racial bias, but there are other forms of biases too, which includes, and really importantly, we're used to talking about, this is about humanity. And I think this went to something Professor Rickford said too, which is that it's more than just about the oppression of Black people. And that we find, it's not just our findings, this is a national finding, that the officers who score high on the authoritarian scale and high on like a toxic masculinity scale, you can think of it that way. People who are like, do what I say and I'm in charge around here. They're the ones who are more likely to commit violence than even the people who are higher on the implicit bias scale, but low on the authoritarian scale. So there are all sorts of personality types that you want in this profession and that you can begin to screen for, but you have to recognize that you can always do better on that front. Like you can always do a bit more, not just cutting edge, but more community involvement. And that was one of the recommendations is making sure that the job description, the position description is clear up front so that not only are we attracting the right people, but they hit the ground with the right ideas about what this community is looking for from their public safety department.
Yeah, great. You explained that very well. But I am aware as well as time went on and as society modernized, I feel like with technology, not just technology, but just in general, weapons modernized as well. So through time, the streets, or you can say society, people, they had knives at one point in time. They were just fighting with, their hands. Throughout time, guns came into play. And now all of a sudden, policing are able to carry guns and tasers now. So it developed through time. I feel like as time modernized, public safety modernized as well. So are we modernizing, or we're starting from the foundation and building back up?
Mm-hmm. And I think I think we should start from a foundation and design from scratch a department that actually fits the needs of a 21st century city. I think to nibble around the edges is to be perpetually dissatisfied and behind the curve. You're going to be constantly not just playing catch up, but getting the wrong outcomes. Or as Schelley is always reminding me, there are no wrong outcomes. The system gets the outputs it's designed to get. So if you're getting certain outcomes, particularly racially biased outcomes, then the system must be designed to produce those outcomes. This is a chance to design a new system, design a new public safety department. And to take our time doing it, right? We don't have to do it this month. We just have to decide that we are going to do it, that we are intent on doing it. And that we can work together in the coming years to design that department, including around technology, which I understand you are using just as a metaphor for broader issues. But for everything from recruitment, training, accountability, data collection, even to how these folks move around the community, how their presence is felt and perceived, what kind of uniforms that they're wearing, if they're wearing uniforms at all. All of those things, we have a once in a lifetime, in several lifetimes, chance to actually design together as a community a whole new department that can fit our needs, instead of inheriting an old system and trying to whittle away at it and win what reforms from it we can.
There it is. Thank you.
Thank you.
Dominique, I wonder if I could take 30 more seconds and then I'll be done.
Yes, and so Mr. Charles didn't speak first. I do want to pass it to Dr. Nia to bring us all back. But Mr. Charles, do you have anything you want to say? Then Dr. Russell will give you your 30 seconds because we do want to be respectful of people's time, and then we'll turn it over to Dr. Nia. Nothing, Mr. Charles? Good. Maybe he's on mute. Trying to get off mute.
It's good evening. All I have to say is let that man do his job and trust the progress. That's all I'm gonna have to say. I mean, I could say so many different things, and if I say certain things, I feel that certain people are gonna be upset if I say something, because I really don't hold back too much what I have to say. But what I'm gonna say is let the man do his job and trust the process. If you don't believe in the process, you just have to wait till the process come to the fact. If it's gonna come whatever way it's gonna come, that's all I can say. But at the end of the day, let the man do his job. Grace and much peace to you all. Have a good day.
It sounds like a good slogan. So Dr. Russell, you gonna let that man do his job, or you gonna take your 30 seconds and pivot us? We're gonna let the man do his job, and we're gonna take your 30 seconds to say, I'm gonna give you 30.
So 2010, Sean Greenwood shot. 2011, Keith Shumway shot. 2019, Rose and Kadri brutalized. Ithaca is no utopia. The safest communities have the most resources, not the most cops. We need to continue to fight for resources. If we're serious about public safety, we need to shrink police budgets and invest in services that meet people's needs. Any attempt to rehabilitate the image of cops is an attempt to discredit the struggle against abusive policing. Just alternatives to policing are community-led and community-affirming. They exclude police and their proxies entirely from responses to harm and insecurity. They rely on community action and healing to address instability. People in Ithaca and Tompkins County have constructed and must continue to construct community models of public safety that work for their own neighborhoods. What are the long-term solutions? Alternatives to punitive policing require the construction of a society that meets human needs: food, housing, healthcare, education, employment, childcare, recreation, creativity, and dignity. We need to build popular movements that fight for a basic transformation of our society, not just rebranding or makeovers of the same system of racist policing. So come join us. I'm dropping in the chat information on getting in touch with the Tompkins County Anti-Racist Coalition and the Ithaca Democratic Socialists of America. Peace, free Palestine.
That was your 30 seconds, right on cue. Thank you for that. Thank you both for lifting that up. Let the man do his job and hear all the things we're also asking for as well. They can coexist. So turn it over to you, Dr. Nia.
Yes, very, very quick. Thank you all so much on behalf of the Southside Community Center, family, board, staff, and community, volunteers of this historic agency. We're 13 years away from being 100 years old, but opportunities, especially to bring Black folks together, to engage, to think authentically, as Harry was mentioning earlier and several others. What do we need to do for ourselves? What do we need to do for our people? And thinking about also what Yasmin mentioned around, sort of interrupting this internalization that we as a people operate with in a variety of ways. So there is absolutely so much work to do. This is just the beginning of beginnings. We continue to begin those. So I understand the frustrations that folks are highlighting in a significant way. But this is critical that we are able to come together like this. And I just really want to thank you all for allocating time to dive deep, to question, to embrace, to push back all the things that are necessary as it relates to being healthy human beings here in Ithaca, New York. So thank you all again for being here, and have a beautiful evening and pay attention.
And with that, thank you all for having me.